So Trump just posted how we're headed towards the Great Depression of 2024. This is what Kamala Harris and Biden economics get you. People do not want this radical Green New Deal left lunatic shit, okay? And they're deliberately doing this. So this was shocking to me as somebody who works in healthcare when I saw this. 40 hospital ownership changes made in one day. Because what are they doing? They're merging all of the healthcare system into one system. 40 in one day. It's deliberate. There's a reason that healthcare has never been more worse than it is now. It is so far from being about health. It's so far from being about care that you can't recognize it. And it's, again, because of the CEOs, your private equity firms. You know, your free enterprise has decided that even though none of the hospital CEOs in this country are elected to shit, they wanted to decide that they will force you into the socialist, communist healthcare system. That's what this headline is. It's very simple here. Of course, Kamala Harris wouldn't know it. Of course, American Nurses Association, all the ones I call out for many years now, don't know this. They've wanted to push their socialized agenda because they're in bed with this crap. But when you have independent hospitals, then they compete with each other. So then each of them competing in your area across the country, the way it used to be, it forces them to have to give the best care, have enough staff, have the equipment we need. But when they all come under one umbrella like this, because higher educated fools pushed this crap, then what happens is that you lose quality. Quality's been gone. Everybody knows it's totally about money, and the people at the top of all the healthcare systems across this country, they don't really care that at this point. To me, it seems like what they're trying to do is fast track merging everything and do all this, everything they've been doing as fast as possible, because likely they're going to try to steal as much money as they can from the system, and then I would say probably run for the hills. That they want to run for the hills, because these people need to be behind bars. That you didn't elect these people, and yet your free enterprise system decided we the wealthy are all going to get into the same building under the same umbrella, and then we can have so much power over the people. That's what this is doing. This isn't, and you're going to hear from Kamala Harris and all the Democrats, AOC, all the bullshitters, how this is good for healthcare. No, none of it is good. I mean, it was bad enough years ago in mental health, because there's so many things you could do to help, like truly help people. But I'm to the point now, I don't think that the people at the top want to help people. I mean, because there's ways we can help people. It's just a factory, really. It's rather disgusting. So these people, I don't care what country they flee to, they need to be all held accountable, because you didn't elect any of these people. There were 5 mergers and acquisitions completed on August 1st that affected 40 hospitals, including one deal that created one of the largest nonprofit systems in the U.S. No matter how much these health systems, the nursing and medical associations tell you this is a good thing or what's good about that can come out of this, no, they're liars. They're stupid, or they're liars, or both. There's nothing, our healthcare system has never been worse. And it's socialism that is destroying it. Just 4 in 10 Americans trust physicians, hospitals, study says. So that's the worst it's ever been. Public trust in physicians and hospitals has sharply declined from 71.5% in April 2020 to just 40.1% in January 2024. The decline in trust of 31.4 percentage points was calculated from an analysis of 24 online surveys, and you can see the rest there. It was from 2020 to 2024, and the trust declined the most among adults between the ages of 25 and 64. They go on to give a bullshit excuse for why. No, there's a simple reason why. You stopped putting quality first. All they do is give lip service to quality. That's all they do. It doesn't mean anything anymore. I think the people that are heading up the healthcare system at each hospital, they're a danger to the country because of their socialized sickness, because you put everything under one umbrella. It's not good. I know Hollywood has lied to people, and oh no, socialized medicine. Nope, you don't want this. Also, what did hurt them though is that COVID, there wasn't enough people that were standing up and saying, no, this doesn't make any sense. I mean, I tried to say stuff, but I'm a nurse. It's who's going to listen. But that more people should have been doing that, not just, oh, we do whatever the CDC says. They're experts. There were too many people saw how there were too many people that wouldn't. People that are, nurses, doctors that are in positions where they're supposed to critically think, and instead just chose to go along with whatever the CDC said, and yet everything they did was a disaster. So people should have seen that. I think that's why people just think, oh, well, it doesn't matter. I just do what I'm told. But no, there's a price to pay when you, especially in healthcare, when you just have that attitude. So that's how we get to this. That's how we get to this place where 40 hospitals or 5 mergers and acquisitions take place in one day. I mean, they're fast-tracking this. They're fast-tracking their communist healthcare system. I'm not trying to scare people. I'm just saying that's what they're doing. I work in it. They do not care about they don't care about anybody. The CEOs are going to throw all of their people right below them under the bus, and they're gonna run for the border. Take all the money they can and run for the border. These people need to be put behind bars. That needs to happen. I don't care how, it needs to happen. When you're this much of a danger to our healthcare system, our society in general, and you've been elected to nothing, you have no right to do any of this, then there needs to be consequences on the level of not just being fined, but that they all have to serve time behind bars. Otherwise, people are going to continue to do this to our country. They're going to continue to think, no, I'm powerful and I have all this money and I can do whatever I want with my other powerful and money hungry buddies that are heading up my industry. And we will all join together in a sick, twisted disease of the head that is obsessed with money, and we will destroy a country. Yeah, no, there should be consequences for that. UCSF Health performs 116 lung transplants in a year. I wonder how many of them really needed the lung transplants. Now, they always spin this as, oh, look at how many we've done. I mean, this is what Northwestern did at the height of COVID, I've said a million times. They were doing double lung transplants, patting themselves on the back, saying how great they were in all their news articles and employee flyers, constantly just raising themselves up like they're heroes, yet while the rest of the world was locked down. So when we have to do more transplants now than ever before, I don't think that shows progress or a track of like success. We should have less. But when you see that the healthcare system is all about money, there's nowhere to find any piece of quality in it, well, then that's when you have to start wondering how many really needed these transplants. There's nothing they won't do. Blatantly in people's faces, how corrupt and sick and twisted these people are. the people heading up healthcare and many of these major industries, they have a sickness for money, and they're a danger to our country, our values, everyone.